أشرقت نفسي بنور من فؤادي حينما رددت يا رب العباد وانتشت روحي وصار الدمع يجري يا إلهي.
Assalamu alaikum warahmatullahi wabarakatuh. Thank you everyone for coming. Welcome to Missle's third and final episode of this semester's mental health series. I'm just going to give a quick intro before we begin and let the speakers take it from here. In this episode today, we will be, inshallah, exploring stress, anxiety, and depression with our host, Brother Yaseen Ghanem. Previously, we explored in episode 1 what mental health is, how to come to terms with it, and some resources. And in episode 2, we touched on addictions, specifically porn addictions. These can be found on our YouTube page. Today's episode will be a special one, as too many have been affected by depression, stress, and anxiety in today's world. We are excited to have our special guest speaker, Brother Yaseen Ghanem. Yaseen is a psychiatric nurse practitioner who specializes in mental health issues related to minority communities and those who are chronically ill. He has a passion for bringing awareness to cultural stigma surrounding mental health and treating patients holistically using evidence-based treatment methods. We're also excited to bring in our past speaker of episode 1 as the moderator of today's talk, Sister Dima Shabane. Dima graduated with her master's in counseling from the University of Missouri, St. Louis. She has been working in mental health for the last 5 years and hopes to help break the stigma as well as the barriers of communication around mental health. Understanding the importance of mental health from a young age is important, so Dima received certification in K-12 school counseling in order to advocate for her students. Without further ado, Brother Yaseen and Sister Dima, you can start whenever you're ready.
Assalamu alaikum, everybody. It's nice to be here again. Thank you for having me. And I also would like to thank Brother Yaseen for taking the time to speak with us this evening. I am really looking forward to tonight's episode. So without further ado, Brother Yaseen, if you would like to go ahead and introduce yourself. I don't know if everybody knows what a psychiatric nurse practitioner does. So if you don't mind going into that, explaining what you do, and then we can dive in.
Yeah, assalamu alaikum. I'm Yaseen, everyone. Nice to meet you guys. So yeah, I'm a psychiatric nurse practitioner. So I kind of do everything a psychiatrist would do. I prescribe medications for mental health concerns as well as do therapy with patients. We practice pretty independently depending on the state. In Ohio, I have pretty much the rights to do everything a psychiatrist does. And we do a lot of community outreach as well.
MashaAllah, thank you for explaining that. So if we can go ahead and dive in, if you would like to give a description of what stress, anxiety, and depression are, kind of how we can, any signs, symptoms, differentiate those between, I guess, sadness and worry, nervousness, and all that. So we could be able to tell a difference.
Yeah, absolutely. So anxiety is very physical in nature because it has a lot of physical symptoms. Some symptoms you wouldn't think are anxiety. Some symptoms include like air hunger, or it feels like you're gasping for air, even though there's nothing physically wrong with your lungs, racing heart, shortness of breath in general, and fatigue. All these can be symptoms of anxiety. Depression also has some physical symptoms, and that can be low energy, that can be loss of motivation, headache. So there's lots of physical things that can happen with mental health illnesses. As we know, the brain and the body are very intertwined, and they kind of feed into each other. So that's the basics on that. So physically, I'm actually having like some shortness of breath recently too. And my doctors are trying to figure out whether it's like asthma or, anxiety. So I'm like, whatever, I'll try medications for both. So excuse me if you see me gasping for air during this, because that might happen. The reason I'm mentioning this is I'm doing a technique called eating the frog. Eating the frog means you do the most uncomfortable thing in a situation first. So let's say every single morning you wake up, you have to eat a frog every day. You could either wait till the end of the day to eat the frog and be worried about eating the frog the entire day, or you could just eat the frog first thing in the morning, and then that anxiety and stress about having to eat this frog is done. So there's a book on it. It's called Eat This Frog. It's a really good book about basically procrastination can lead to unneeded stress and unneeded anxiety, and to just get over the hard parts of your day towards the beginning.
Thank you for sharing that. That's definitely something I think we all struggle with, especially with procrastination, especially during the pandemic.
Yeah.
And I know that anxiety and depression, especially during the pandemic, has skyrocketed. And I'm certain in our Muslim communities as well. How would you suggest we, go about that, deal with the anxiety and the depression, especially with the stigma within our communities and in our own families?
Yeah, so the first thing is recognizing whether you have anxiety to begin with. And, it's kind of just like taking a good look at yourself. So I was in denial that I had anxiety in the past, and a way I recognize that is because when I was new to the field of psychiatry, I would see patients with schizophrenia. Those are patients who hear and see things that are not there, are talking to themselves, have hallucinations, all these different symptoms that we think is what, we stigmatize as like someone who is crazy, right? I would look at these patients with schizophrenia, and I would see they would be in denial that they had a mental illness at all. They thought that these people in their head that were talking to them were real. And I was like, how can these people not realize, if there's all these doctors telling them that they're mentally ill, that they can't understand that? And then I took a good look at myself, and I was thinking, look at me in the last year. How many situations did I avoid because it made me anxious? Or how many times did I have to lay down until my anxiety subsided? Or how many times did I have to, did I miss out on certain situations because I'm neglecting my own mental health symptoms? So recognizing that you have an issue is really hard for a lot of people to do. And once you've done that, then you can take the proper steps to treat it. So recognition is number one. With the stigma, know that, when you see someone in the mental health field, no one else needs to know about it other than you and your provider. So you don't have to worry about people in the community finding out. It is a shame that there is such a stigma, but it's just between you, yourself, and your provider. So you shouldn't stop seeking treatment just because you're afraid of what people will think.
Absolutely. And I've also noticed an increase of just all across the board of people saying, if they're sad, just labeling it automatically as I'm depressed, I have depression, or, I failed a test, I'm so depressed. I failed my driver's test, I'm so depressed. Or how can we differentiate that when it's clearly sadness and not depression? How can we differentiate the two and know whenever we need to seek help?
Yeah. So everyone's on a roller coaster with their mental health, and some people have big drastic drops in the roller coaster, and some people have subtle little waves. So everyone just knows there's going to be ups and downs, and that's normal. The difference between depression and just feeling sad or upset is depression is going to decrease your ability to function normally throughout your life. You can't get out of bed to go to work in the morning. You're pushing people away who care about you. You're not motivated. You don't enjoy things you used to enjoy. So that's the big difference, because although I failed my test yesterday, if someone says we're going on vacation tomorrow, I'm still going to be excited about that. Someone who is severely depressed, nothing really will excite them. They will have what's called anhedonia, which means loss of interest in activities in which they previously did enjoy. So that there's a big difference there. And it just because you're not always depressed doesn't mean you don't have depression. It's a very complicated and broad spectrum illness. So.
Thank you for explaining that, because I do know that is a big thing, and not just with depression, with a lot of other mental illnesses, including schizophrenia and bipolar and OCD. And for those with depression, anxiety, any stress-related disorder, what do you suggest the first step be for, whether that be like therapy, seeing a psychiatrist for medication? What's the first form of help that you would recommend?
So that kind of just depends on the person. Some people, you just got to realize that if you had heart disease, okay, you would go to a doctor and you would treat that right away as aggressively as you need to, right? But if you have depression, people will tend to just let it sit there and not treat it and let it go on for a long period of time. So the difference is there isn't much of a difference between the two, because depression, like heart disease, can become progressive and permanently progressive in some circumstances. So people who let depression go for several decades will have what's called treatment-resistant depression, where treatment really won't help much anymore because they've let it go so long. So it's better to be more aggressive with treatment in the beginning. So go see a psychiatrist, a psych nurse practitioner, whoever, and see if they recommend based on your symptoms and medication. You can just do therapy, but a medication isn't as big of a deal as people make it seem. When it comes to like SSRIs, which are antidepressants, they're pretty basic. They're not like heavy medications for most people. What they do is they basically keep serotonin that your brain already has in your brain instead of getting rid of it. So you're not adding some crazy new chemical to your brain. You're just holding on to whatever your brain already makes. So it's not like you're, adding this new change of personality, or it's going to change who you are. If it's dosed slowly and correctly, it should avoid a lot of side effects. Of course, there's risks and benefits to either treatment or not treatment.
Absolutely. And there is one person on the Zoom who is asking, would you recommend them stay on medication forever? If, let's say, therapy is just not helping and they are on medications, would you recommend them just continue, obviously, to see their psychiatrist or nurse practitioner, but what are the pros and cons of staying on medications forever?
So there is some circumstances where if you're on a medication for like 10 years, it can start to be like less effective. So you would talk to your psychiatrist and maybe switch or whatever you have to do or come off of it. They recommend for like depression, you're at least on it for 16 months and then maybe start to wean off of it and see if you're able to handle it, whether your circumstances have changed or life has gotten easier or your stressors have gone down. And you're feeling better, you can come off of these medications. They're not like a life sentence. And people often think if you start antidepressant and come off, your depression is going to be worse when you come off. That's not necessarily the case. What happens is your anxiety or depression just comes back and you're not used to having that anymore. So when you come off these medications, you feel like you're worse, but you're not necessarily worse. You're just feeling how you used to feel.
Thank you. I also was hoping that we could also angle this in for Muslims that do see this as a stigma. And if you have worked with any Muslims and how they kind of deal with any mental illness diagnoses that they may have, specifically depression, anxiety, and how you would align lack of faith lack of faith, lack thereof, and mental illness, if there is a parallel.
Yeah, so we have a lot of, I don't know if you guys have ever heard of Catholic guilt, where people who are Catholic, they feel like guilt because they're not doing what their parents expect them to do. We have something very similar with Muslims, where we have the need to please our family, sometimes at the expense of our own well-being. So a lot of people will say that their mother says that they're depressed because they don't pray. While that can be a factor, spirituality is a protective factor for depression. That isn't the only variable in the case. So just because you don't pray doesn't mean that's why you're depressed. In fact, you might be depressed, and that's why you're not praying, because you don't have the motivation or that connection to have motivation to do so anymore. So treating your depression might bring you closer to God versus the versus the opposite. So unfortunately, these stigmas, I think they're beginning to change, and the younger generation is really doing well with that. But we still have to work with the older generations and educate them about the importance of these things. In my community alone in Cleveland, where I live, I've seen time and time again where these young men are dying, and whether it's from addiction or suicide, everyone just says, oh, his heart stopped. That's what happened. He just died in his sleep. And 9 times out of 10, that wasn't the case. It was either addiction, which is a mental health problem, or depression, or suicide, stuff like that unfortunately does happen. And by pretending like it's a medical thing, because we're so ashamed of the stigma related to mental health, we're doing a disservice to our community. And so we really got to continue to work on that and talk about it like we are today.
Yeah, I absolutely agree. And you're right. Being able to talk about it. And I want to thank Mistel for having this series. And hopefully this will be the first step among many communities to openly talk about it and bring awareness towards this, especially in the older generations, because it is harder for them to wrap their minds around it and to understand, which is understandable considering, it was never talked about before and it was not really something that they thought about. So whenever you do give these diagnoses, whenever you see it in your communities, are they well accepted between young and old individuals? Do you feel that they have a hard time accepting the diagnoses and actually taking a part in the treatment? Whereas any other communities or members of different communities may be more open to it.
So it depends. There's people of all communities who struggle with diagnosis, but particularly men that I see that are Muslim struggle to, even if they accept their diagnosis, they might not accept the fact that they need a medication. They might think there's something else. So it kind of just depends. They might accept their diagnosis and think about taking medication and then decide not to take medication. I'm not saying everyone needs to take medication. That's always indicated. But it can make the difference between a quality of life and not having a quality of life. Some people go years and years and years staying home because they have like agoraphobia, which means they're afraid to leave the house or be in social situations, where if they would have started a medication, they would have been able to experience these life experiences. So maybe taking a medication might be the difference between living a quality life and not living a quality life. And if that's the case, taking a pill every day to do that, why would you not want to do that? Of course, there's downfalls to medication, but for many people, it is a necessity, and you should do it if that's what the doctor recommends, and you can always get a second opinion.
Okay, absolutely. Thank you. What is something that we can do, signs and symptoms that we can notice on others before offering help, or to notice that there is something wrong, that they may need help? Because I do know one thing with depression is that somebody who is depressed will most likely not reach out for help or not know how to reach out for help. So what can we do to help those that may be struggling?
So you're going to look for someone who's withdrawn from people. So oftentimes people get mad at others because they haven't decided to talk to them or reach out to them in a while. So you get frustrated. Oh, so-and-so hasn't called me in a while. They don't want to be my friend anymore. Maybe it's the opposite. Maybe that person is going through something really difficult and you can't see that. So reaching out and checking on people, especially in a pandemic where everyone's secluded, is really important. And that's going to be the big thing. And sometimes people who are depressed do give signs that they need help and they're crying for help, but they do it very subtly. Like sometimes people might mention in a joke, like how they wish they were dead or something like that. And you actually have to take those more seriously, even if it seems like a joke, because sometimes that might be the case. And religion is a protective factor. So in psychiatry, we look at people who are religious as a plus in many ways, because a lot of religions believe suicide is against their religion. So that prevents many people from committing suicide who might have, if they didn't have faith. I'm not saying that those who are agnostic or atheist just all commit suicide because they don't have faith. But what I'm saying is that religion is in many times a plus in that way. So, it's important to just keep an eye on the symptoms, regardless of faith and regardless of their situation.
Okay, and so you mentioned them not reaching out, being withdrawn, and some subtle signs. What are some of the subtle signs that you would recommend looking out for?
Again, a lot of it is going to be the withdrawal that you'll notice. They don't enjoy going out with friends anymore. They're staying home. They're missing days of work. You can tell by their face. It's what's called an affect. And a flat affect is somebody who won't smile, won't frown. They just always have like a flat face. That's like a sign that somebody's depressed. So you can keep out for these warning signs. It's not your job to, necessarily, invade someone's life unless you're very close to them, but it is good to check on people and do what you can do.
And would you, let's say somebody that you're not necessarily close to, what is the best way about going about getting somebody help? If it is a sibling or a friend or just an acquaintance, what is the best way without possibly straining the relationship or putting a strain or making things awkward?
If you're worried about it to the point where it is you feel like they might be in danger of harming themselves or others, you can just do an anonymous welfare check. That's for extreme circumstances where you just call 911 and say, I think we should do a welfare check on so-and-so. Here's where they live. And they will never know who called to do that welfare check. That oftentimes is indicated. For people who you are close to, just simply asking them, are you okay? And kind of looking and offering them resources if they're willing to. It's going to be hard to force somebody to seek treatment, but if they have a part of them that wants help and you can offer them the resources and present it to them, then that can make the difference as well.
Thank you. Trying to think, you did mention spirituality and religion being a protective factor. What are some other protective factors that we can do, that we can start or continue doing to help avoid any mental illness, specifically anxiety and depression, or putting off some of the symptoms that may already be arising?
Dealing with trauma is huge, and there's like a whole new push on trauma and how important that is. So if you've gone through something traumatic, that's a huge predisposition to mental illness. So if you've gone through, an extreme violent crime, or you've witnessed something, or someone passed away and you have symptoms of PTSD, which include flashbacks, nightmares, stuff like that, doing trauma therapy is extremely important, because if you let trauma kind of eat at you over the years, it does develop into other illnesses, sometimes physical ailments, sometimes anxiety disorders, depression, and so on. So trauma is something you should really address. People who were in the war, people who lost people in the war, all these different types of trauma need to be addressed. Whether it's through medication or not, there's something called EMDR therapy. It's a very specific trauma-based therapy where you engage your eyes and your physical body while you're thinking about traumatic moments, and it helps desensitize the brain to trauma over time. So there's a lot of options, and if you feel like your trauma is taking part of your life, you should take control over it before it takes control over you.
And thank you for mentioning EMDR. I do know I worked I currently still do work in a psychiatric hospital, behavioral health, and we do push our patients to seek therapy, especially EMDR. A lot of them do have a lot of traumatic have gone through a lot of traumatic events in their lives, or just, CBT, cognitive behavioral therapy, just even if there's not anything huge or traumatic going on in your life, therapy is healthy. Talking to an unbiased third party is always, it's just therapeutic in itself. And it can also be a protective factor, in my opinion. That nothing necessarily has to be going on, and your life doesn't have to necessarily be falling apart in order to seek a therapist. Getting ahead of the game and talking to somebody ahead of time will absolutely help. So someone's asking if someone should do CBT over medications. What are your thoughts on that?
It's very dependent on the situation. I would recommend a professional evaluate that. CBT is always helpful and medication is always helpful. What does the research say? The research says combination of medication and therapy is the most effective treatment. And remember what I said about, like, if you were diagnosed with, God forbid, cancer, heart disease, all these serious medical conditions, you would treat it as aggressively as possible in the beginning until it starts to be in remission. That's the same thing, in my opinion, with mental health. There's other theories on it. If you need a low dose medication and therapy together, that can have the most benefit. And the reason why you want to take care of mental health early on is because when you're stressed out, and anxiety and depression is a stressful situation, your body releases cortisol, which is a stress hormone. And with cortisol, that deteriorates your nervous system. It literally eats away at your central nervous system. So stress kills you. Mental health issues not being managed kills you. For example, patients with schizophrenia live a lot shorter lives than those who do not have schizophrenia, and that's an extreme example. So it's sad, and it should be addressed and treated effectively for sure.
Thank you. And can we talk about the how depression and anxiety and any mental illness could also create physical ailments in the future? How that could affect every other, stress, how stress can lower our immune system and affect every other part of our body in the future if not taken care of.
Yeah, that's definitely the case. As I said, it does lower immune system if you're stressed out. There is some question whether diseases like fibromyalgia are partially caused or influenced by depression and anxiety. Fibromyalgia is a disease that causes pain and fatigue. There's a disease called functional neurological disorder. It's where, or conversion disorder is what it used to be called. And what that is where people who have gone through something traumatic will have physical symptoms. So sometimes people have seizures, non-epileptic seizures, because they were, let's say, trigger warning, raped as an adolescent. That can lead to someone who might have seizures, or somebody who might have become paraplegic, like they can't move any of their arms or legs from mental illness. Like that, it turns from a mental illness to a physical neurological problem. And those are extreme cases, but they do happen, and it can be really devastating for a lot of people. Some people can't walk anymore after getting some sort of conversion disorder. Are you with me? I think she's frozen.
Okay, I'm not sure if it's okay. I think you're back.
I can hear you now. Yeah.
Okay, perfect. SubhanAllah, how it's mind-blowing how something as we may think as simple as depression that a lot of us don't even think is real, could lead to such failures in the body. how our mind is truly it truly runs everything. And so in order for our body to function the way it's supposed to function, we really need our brain really needs to be healthy. And it makes me sad how the brain is really the last thing that we think about helping and fixing and taking care of, so the rest of our body and we could have long healthy lives for as long as we can. But especially in our community, it's the last thing that we think of. Taking care of.
I worked for 3 years, I worked in a neurosurgical ICU where people had brain bleeds and strokes and really severe neurological events. And one thing I noticed with that is people would literally go from not being able to move their arms and legs or talk or breathe on their own to a year later walking back and thanking us in the ICU for help saving their life. And so if the brain can go from no longer being able to move your arms and legs to walking in and thanking me in the course of 16 months, mental health and many times can be reversible and treatable as well. So don't underestimate the brain. There's people who have been depressed for several decades and then make miraculous recoveries. The brain is a very powerful organ with healing powers. So as much as a stroke may kill a part of the brain, a lot of the brain can start to reconnect itself over the first 12 to 16 months after a stroke or a neurological event. So if the brain can heal such drastic measures of being bedbound to walking again, imagine what it can do if you actually put effort towards your mental health. There's definitely something to be said about how powerful the brain is and how we underestimate it as a society.
No, absolutely. And just like somebody just said in the comments, it's not a life sentence. Depression and mental illness is not a life sentence. And something I think that something you said in the beginning is just it's a roller coaster. So you can have a diagnosis of depression or schizophrenia or anxiety and have your good and bad days. It does come up in episodes. You don't have, whenever you're depressed, it's not necessarily you're bedbound for the rest of your life. You can have your good and bad days, and medication and therapy are a big reason for that. They help a ton. How would you go about, what advice would you give to our parents or older generations on how to talk about these kind of things with their families and with their children? Because I do know that it is hard. It may be easier for our generations as we're coming up into this, but the older generations and possibly the parents, how to talk about this, how to start conversations about mental health and depression and anxiety within their families.
Well, first off, if you're a parent, your kids will tell you if something's wrong. They'll show you signs that something is wrong. It's a matter of listening a lot of the time and not brushing it off. If someone, they say women who are, another trigger warning, women who are raped often struggle to come forward because how difficult it is. In a lot of ways, if someone is saying the words, "I'm depressed, I need help," you really should be listening to them because it's really hard. Most people will just internalize that. So if your kids are mentioning that, that's for a reason, and you should help them get help. There are signs, and a lot of times people, when it's too late, look back and think, wow, there were so many signs that this person was depressed. We should have done this, or this. It doesn't have to be that way. It's hard for the older generation to understand sometimes that depression is not just cured alone with prayer. God gives us permission to seek medical help in the same way God allows us to seek mental health help. I think God wants us to take care of ourselves. And that's why it's not just prayer. Prayer is a very important component for people who are spiritual, but it's not the only component. And if you just rely on that and that's not working, then you might be doing yourself a disservice because, just because you're religious doesn't mean that you can't actively take care of yourself.
Absolutely. And I feel like burden that comes with that, with putting that we put on our children and we put on people in our community is, you know, your faith is low. You need to go pray. But one thing is with depression, when you're depressed, that can affect your prayer. And I think that you mentioned that in the beginning. It's, you know, those who are depressed may not have the energy or the motivation or have it in them to get up and pray. So that's just another burden adding on to them that's increasing their depression and affecting them even more. There was a question, and I don't know if you'd be able to answer this. A daughter in the community has panic attacks whenever she has exams. She can't breathe, sometimes throws up. She has severe headaches, and they want to know what they can do about this in the future. And I do know that those are all signs that we should also look for in our children whenever they do constantly complain about headaches or stomach aches. Those are also signs of anxiety and additional illnesses.
So the fight or flight response is the body's stress response. So when someone's chasing you who shouldn't be chasing you, your body will, release the hormones to go into fight or flight mode. Your heart rate goes up, your breathing goes up because your body's ready for you to start taking off and running because you need to protect yourself. With these panic attacks that this young girl is having, she's having the shortness of breath. She's having, physical stomach pain, headache, all these symptoms of her fight or flight response going off. That's abnormal for it to go off that severely for something like a test that should be routine. So that would be indicative of a panic or anxiety disorder. So a low dose SSRI medication like Prozac or something might help her, depending on her age, might help her prevent that stuff from happening. Or when they do happen, they're much less severe, or like as needed medications can really help. And the best treatment to anxiety is exposure. So just because she might need the medication now, if she continues to be exposed to tests or things that make her anxious, that fear will eventually start to go away if she continues to participate in them. But if she decides to start staying home because she's so anxious and she doesn't want to throw up, then she's making her anxiety disorder worse because she's doing the opposite of being exposed to those triggers.
Absolutely. Thank you. Another question, and this one I feel like is loaded, no pun intended, but it's a bit heavy. It asks about your thoughts on the Colorado shooter. It was said that he was mentally ill and his family did notice signs but did not intervene, as well as with the Texas massacre, or the killing. Do you have any thoughts on that?
It's hard for me to answer that question, but I will say that I've had patients who have told me they have thoughts of committing a school shooting. Okay, so there are signs. In the case that I'm talking about, the person's getting help, right? So if someone is expressing something like that, it should be blatantly obvious they need mental health help. The issue is they might not have the resources, or schools or whatever are not identifying these children as they should because they're short on resources. Whether you're Democratic or Republican in the United States, it tends to be both of them say, well, if it's not that we need to do gun control, we got to focus on mental health, or, the Republicans will say mental health and the Democrats will say mental health, but neither of them fund it appropriately. Although they both are blaming mental health as the reason for these shootings, no one is actually putting their actions with their words as far as giving the schools the resources they need to identify children who might have some sort of illness that might make them predisposed to doing something like a shooting.
Yeah, and then another thing I would suggest is, again, like you mentioned earlier, with noticing the signs and symptoms, getting somebody help. I do know with the Dallas shooting, reading the manifesto, their friends had left them. They kind of made their depression not a big deal. It's just like, oh, you have depression, so do I. It's no big deal. Every case is not the same. No two cases are the same of depression. And every person deals with it in a different way. And so just not leaving your loved one, understanding their illness. And from the sounds of things, their parents understood. They were on medications. They were seeking therapy, but it was just so intense. They were going through some sort of episode to where it just this happened, but just not leaving our loved ones and no longer being friends, or just what's the word I'm looking for? Just making what they're going through not that big of a deal, because you just don't understand, or you're diagnosed with the same thing and it's not as severe. So validating what others are going through, trying to understand, and just being there to support them, because having a support system is huge. I know, whenever we do our risk assessments in the hospital, one of the protective factors is, do you have a support system? Is there somebody that, if you do have these thoughts of suicide or hurting yourself, is there somebody that's making you not want to, somebody that's wanting you to stay back? So that is huge. And just being there for others and validating and empathizing is big.
Yeah, absolutely.
Go ahead. Sorry.
I don't know if you wanted to hit any of the other questions.
Yeah. Do you have any advice on how to deal with diagnosed depression and anxiety while being Muslim and having to complete certain religious obligations? I often find myself being unmotivated to do the bare minimum, but I'm still anxious about going to hell because I feel like an incomplete Muslim. I try to complete these religious obligations, but I find myself extremely unmotivated and unhappy while doing them. I see people say things such as, "You're going to hell, just do better, that's haram," and they all make me feel like I'm a bad Muslim and a bad person.
Yeah, so your relationship with God is between you and God, and if you're going to be advised by people around you, it should only be the people very close to you, and everyone else's opinions really shouldn't matter. So even our religion says that you should only advise people in a non-judgmental and private manner. So, commenting on someone's Facebook, "This is haram," cover yourself up, or, something like that. You're committing a sin by doing that, because you're doing the exact opposite of what the religion preaches. So a lot of these people's opinions, you need to, unfortunately, realize you have to let it go. You're never going to be able to please everyone, but God, I believe, knows what mental illness is. And if you're struggling with depression and you're struggling, he will forgive you if you are willing to take care of yourself. But you should take care of yourself. And the decreased motivation is a huge symptom of depression. So if you get your depression treated, hopefully you can complete these obligations you feel like you're not able to complete right now. But I think, God is forgiving. I think depression is an illness. And just like you would be sympathetic towards someone who is physically ill, I would feel the same way towards people who are mentally ill. To be sympathetic and forgiving, and to not judge them for things that honestly they can't control. If they can barely get out of bed, how are they expected to perform certain tasks?
Thank you. And do you think hormonal imbalance plays a role in depression?
Yeah, so not hormones can play, women on birth control can often get depression. Sometimes you can just take someone off birth control and their depression will go away completely. So that indicates that depression can be caused by hormones, but also imbalances of things like serotonin and dopamine, which can be regulated with medications, exercise, yoga. All these things play into those, and the foods you eat, they all play a factor. And it's someone who can eat healthy, go running every day, not on birth control, and lives a productive life, can still be very depressed. And that's when a medication might be necessary as well. Those things can help, but is it enough to bump you out of it? That's a situational question, but it should be thought about that way.
I feel like we touched up a little bit on this, but what are some things you should not say when someone diagnosed with a mental illness reaches out, or just being around someone is dealing with it? What about if someone confesses they are thinking of attempting suicide? How do you react, and at what point do you call 911?
So if they admit that they have a plan or intent to hurt themselves, that is when you would get the authorities involved. If they're just fleeting thoughts of suicide, sometimes the thought just comes in your head. That doesn't necessarily mean that they're going to be involuntarily admitted to a mental hospital. They have to meet certain criteria, such as they can't take care of themselves, or they are actively going to plan or intend to hurt themselves. Because if the police come and they don't admit to actively wanting to hurt themselves, then the police might leave. So it's trying to get them help before it gets to that point, and trying to keep them surrounded by people at all times if you do suspect that they might do something and they're not admitting it. You shouldn't act like depression is a choice. I've had people say, oh, my partner, she just chooses to be depressed. She just lays around all day. I love life. I would never just waste my life sitting on the couch like that. I don't understand how she can feel that way. Some people are genetically predisposed to depression. Like, some people just are 13 years old and they all of a sudden just start feeling super depressed because they're genetically predisposed to it. So it's never a choice. I don't know why anybody would want to actively choose to be depressed. The only choice is whether they choose to seek treatment or not, and you can support them in doing that.
Thank you. I think that's a very important piece, because I have heard within our community, it's all in her head, or it's all in his head, and he just needs to stop thinking that he's depressed, or he just needs to not want to be depressed anymore. I don't think it's, being depressed is not fun. Anybody who is actively depressed does not want to be in that state, but it's just not something that they can change unless they have the medications or the therapy or both. How can I tell if a teenager is just being a teenager, keeping to him or herself, not sharing much, and being disrespectful to parents sometimes, or if they're actually depressed?
So that's unfortunately hard to tell without not all the information. It kind of just depends. Are they still hanging out with friends? Are they still motivated to complete schoolwork? Are they expressing thoughts of depression? So that's kind of hard to answer. But yeah, to an extent, teenagers do act that way. But that doesn't mean you can't get them involved in therapy early on, and maybe they can talk with their therapist about it. There's a lot of faith-based therapists as well. I know in Chicago, they have a Muslim mental health center where they have Muslim therapists who understand the Muslim lifestyle. And if you're worried about a therapist leading them in the wrong direction, you can actually take them to someone that understands the cultural and religious norms of being Muslim. So that's what I would recommend. And seeing if they work through it with a therapist. If things don't get better, maybe look into a psychiatrist, or it could just be as simple as asking your teenager, how are you feeling? How do you feel I'm doing as a parent? Just because parents are supposed to be respected, and they should be, doesn't mean that parents are perfect, and doesn't mean that they shouldn't try to improve in being a parent. So simply asking your child, what bothers you? What can I do to make a difference? Might help with that as well.
Thank you. I have one more question, and then we will begin wrapping up. How do you help people who have depression or anxiety, who are going through a divorce? They think they've wasted decades of their life. How do you help them see the positive side?
The positive side is that they are moving to a new chapter. They're no longer dealing with the stuff that came with the marriage. And they had the confidence to leave, which many people don't have the confidence to leave, unfortunately, especially in abusive relationships. They tend to be a cycle. Some people die in an abusive relationship. So if you feel like that partner was emotionally abusive and this person was able to get out of it, that's something worth celebrating.
Absolutely. Completely agree. We're going to turn this back to you to see how do you deal with being in this field, dealing with depression, anxiety, schizophrenia, patients who are suicidal, and what made you want to go into this field?
Yeah, so there was I don't think I said this already, but there was I was 19 years old. I started in a mental health hospital as a nursing aide. And there was this young gentleman who was like the star of his high school, very popular, good looking, had a girlfriend, had friends, was the star life of what you would think an American non-Muslim would want to live, right? So this gentleman had an aneurysm at a young age in his early adulthood or adolescence, and he is now bedbound and intellectually disabled and can't move the one side of his body. And his girlfriend left him after this, and he will never be able to work, never be able to go to college, and because of this aneurysm. And I was taking care of this guy, and he was so happy that I decided to turn on the computer and play him his favorite, his favorite song. So that was me. I was just watching him over him, and I just did the simplest thing, and it changed his attitude, and he lit up, and he was so excited. And I realized how little of a thing can make the difference in someone's life who you think this person will never be able to feel happy again because they've lost so much. They can't get out of bed. They can't do anything they thought they would with their life. I was able to make his day by just going an extra step. And when I met that kid, I humbled myself and said, I mean, I have so much to be thankful for. But also I can make such a difference with such a little bit of effort. This is a field I would love to explore and hopefully help people in the masses. And, I've also gone through some mental health struggles myself, and recognizing, the difference I was able to make in my own life. I'm using my own experiences to really help patients. Have I been on an antidepressant before? Yes. Did it help me get through a period of my life? Yes. Would I recommend that experience and open up to patients and be willing to confess that I was on an antidepressant? Absolutely. I would tell every patient if they asked me personally, because there shouldn't be that stigma. Like a young guy my age tends to be ashamed of admitting something like that. I don't have an issue with doing that. So it got me out of a period of my life where I was experiencing what's called like passively suicidal. Basically, I would put myself in dangerous situations and not care what happened. So I would be walking through like a dark alley at 3 a.m, where normally a normal person would feel like they should be afraid. Where my thought process to myself at that time in my life was, well, if something happens, it's fine. Like, I don't really care. Did I actively want to hurt myself? No, but I was willing to put myself in harm's way. And that's when I knew I needed maybe something. So.
SubhanAllah, thank you so much for sharing. Your experiences, I feel my favorite way to learn about anything really is just to hear stories. I feel like people's stories are the best way to learn. And I can definitely connect with you. I started out my journey in mental health as a nurse's aide in a psychiatric hospital as well. And I still find myself, whenever I think about the stories and the people that I came across, just saying alhamdulillah for the life I live, alhamdulillah for, being able to help these people and putting a smile on their faces by doing, to us, it's the most simple things, but to those who are going through anything, whatever it is, whether it be something very extreme or minimal, it truly brings a whole new level of joy. So thank you so much for sharing. 2 more questions. What was your educational path? What degrees did you take? What path did you take to get to where you are now?
So I have 2 associate's degrees, which the one was just by chance. The second one was nursing. Then I got my bachelor's degree in nursing. Then I got a master's degree as a psychiatric nurse practitioner. And between my bachelor's and my master's, I had a total of 4 years of nursing experience. in which I worked in intensive care units, so I got a good medical background. I worked in an inpatient psychiatric unit. So I got to kind of see the different types of nursing, and that really guided me, along with my personal experience, to what I wanted to specialize as I became a nurse practitioner. Here in Ohio, where I see patients, I tend to specialize in areas that I'm most familiar with, and that's those with chronic illnesses and those who are minorities and who struggle with mental illnesses associated with those things. So it's been a lot of my education has been self-education on top of obviously my degrees, but I decided to kind of focus on what I was passionate about, which was independent of my educational path, which is what psychiatrists do. They tend to focus on whatever they think they're most passionate about, and that's what I did. So here I am.
Thank you. And then, so just to end this off, if you could just share, if you want to wrap up or share what you feel like is most important on the topic, we would love to hear it. Thank you again so much for taking this time. We truly are very grateful. This is such an important topic. And this was awesome. Thank you.
I thank you guys so much for having me. I want to just end off with a couple points. Just know that Islam believes in mental health. Stigma is unwarranted. It's a cultural issue, different than the religion. The Prophet Muhammad Sallallahu Alaihi Wasallam, he had nervous and anxious feelings before war, and that's not something that is as degrading to our Prophet. That's because he was a human being who cared about his people and was worried about losing his people. So if the Prophet who we look up to had anxiety, we shouldn't be ashamed of having anxiety. That's something I've said in the past that angered many people in something I posted in the past, and it really shouldn't have, because that's not a negative thing at all. It's just part of being human, and it's a natural response, and it's normal for the body to have anxiety. And make sure you eat that frog, and don't procrastinate, because you're just gonna make your self stressed out for no reason. And it was a pleasure, and I thank you guys all for watching.
Thank you for being with us, and thank you again to the organizers with Muslim Youth of St. Louis for having this and for taking this huge step towards destigmatizing mental health within our communities. Jazakallah khair.
أشرقت نفسي بنور من فؤادي حينما رددت يا